Hi everyone, I'm Dr. Arif Akhtar. When a patient's kidney fail, there are two main life-saving choices that he can make. That is, one is the dialysis, other is the kidney transplant. So, which one actually save more life? Today we'll break it down using the latest data in the science, and I will share a real case scenario to show what this means in practice. So, what are dialysis and transplant? So, dialysis means hemodialysis, whether it's a peritoneal dialysis, does the job of cleaning the blood, controlling the fluid and electrolyte, but does not replace all kidney functions, frequent sessions, infection risk, and the cardiovascular stress. Now, kidney transplant means replacing a failed kidney with a donor organ, living or diseased. It requires surgery, immunosuppressions, long-term follow-up, and risk of rejections. But in toto, it restored many of the functions which was naturally present in kidney. Now coming on to the survival data, here is what recent scientific studies tell us. Overall survival benefit, a 2022-23 Australian cohort using target trial emulations showed that the transplant eligible patients who got deceased donor kidney transplant has a longer life expectancy than those who stayed on dialysis across all age group and waiting time. This was published in JAMA Network. Now coming on to the liver donor kidney transplant versus hemodialysis, this study was published in Japan, where so the liver kidney transplant decreases the mortality risk by 50% in over 7 years of time, which was generally higher than the life expectancy as compared to when the patient is staying on the dialysis. Now in the first year, survival rate between the transplant recipient and those on the dialysis are often similar. For example, the study shows that 94% 1-year survival among transplanted patients versus 95% for dialysis patients. But after the first year, the transplant patients diverge and do much better as compared to the dialysis patient. Now coming on to the graft survival, how long the transplanted kidney keep working has been improved. In the living donor kidney transplant, median graft survival duration has increased over time from 12 to 19 years over recent decades in higher income settings. Now coming on to the age and the dialysis vintage, durations on dialysis before transplant. Older patients gain life expectancy benefit too. In the Austrian study, a 60-year-old get 3 years extra years with transplant versus staying on dialysis over 10-year period. But waiting long on dialysis, that is known as dialysis vintage, before transplant reduces the outcome. Longer dialysis before transplantation is associated with higher risk of the complications and worse overall graft survival rate. Preemptive transplant, that is the transplant which is happening before the long-term dialysis, is clearly superior to overall transplant. Coming on to the mortality rate as compared to the dialysis versus transplant. For transplant recipient, the 5-year graft survival rates is close to 80 to 90% with the living donor, 80 to 85% for the diseased donor in the young adult recipient. Cost and the quality of life also tend towards the transplant. In Sweden, there was a study which was published. Although transplant have a high cost in the very first year, in subsequent years, healthcare costs are much lower than what is for the dialysis. Over 3 years, the transplant patients avoid in large proportions of expected cost versus staying on dialysis. Now, coming on to the most important thing, that is the quality of life. Now, the quality of life is much better on the patients who has underwent transplant as compared to the dialysis. Now, I will talk about a real life scenario. Here is the case. Mr. Singh, who came to me age 62, he was a known case of diabetic nephropathy, has been on dialysis for the last 4 years. He is otherwise stable except for some of the cardiovascular risk factor. He get evaluated and found eligible for a diseased kidney donor. Now suppose he received a transplant this year. Now according to the Austrian study data, as a 60-plus-year-old, Mr. Singh could expect almost 3 extra years of life over 10 years compared with his staying on the dialysis. If instead he wait for another 23 years and stayed on dialysis, his survival will worsen. Even after transplant, longer dialysis, vintage means higher risk of the graft loss, infections, and of course the cardiovascular morbidity or complications. Additionally, his quality of life, hospital visits, cost burden would be less with a successful transplant than continuing long-term dialysis. If transplant is not possible because of whatever reasons, lack of the donor or multiple comorbidity, dialysis may extend the but significantly higher mortality and decreased life years. Now, what influences whether transplants save more life in a given patient? The first one is the donor type. Living donor kidney transplant often has a better graft survival, lower mortality. Time on dialysis before transplant, shorter is better. Preemptive or early transplant gives best outcome. Now, coming to the age and the comorbidity, older patients or existing cardiovascular disease like diabetes, etc., decreases the benefit but do not completely eliminate it. Even a 70-year-old drives benefit versus staying on the dialysis. HLA matching, immunological risk, immunosuppression regimen, and the post-transplant care. So these are the factors which determine the overall benefit of the transplant over dialysis. Now, here is what transplant does not always cover. The first one is the organ shortage. Many eligible patients never get transplant due to lack of donor organ or because of delay. Now, the surgical risk includes including immunosuppressive risk like infection and malignancy. Graft failure, which is theoretically there, eventually graft loss is still possible after many years. Some patients have contraindications for the transplant, including severe comorbidity, poor surgical risk categories. And we use different methods or sophisticated methods, including target trial emulations, propensity matching. Some bias remain. But the weight of the evidence strongly favors kidney transplant in eligible patients. Now, here is what this comes down to. If you are eligible, transplant on balance save more life than the dialysis. It gives longer survival, better quality of life, and after the first year, lower cost. The gain is higher if the transplant is done early with a living donor and the patients without extreme comorbidity. But even older patients gain years compared to the remaining on dialysis. For patients and family, aim for transplant if possible. For healthcare system, increase the donor availability, decrease the wait time, and improve preemptive kidney transplant program. Thanks.